When my doctor told me I had cancer, it was kind of a whirlwind. I didn't really have any feelings at the moment. I was just kind of numb.
Being diagnosed with cancer definitely promoted those thoughts of uncertainty and what was going to happen to me and how was I going to attack my diagnosis.
I was diagnosed with bladder cancer. So my first sign was blood in my urine.
When I was first diagnosed with cancer, it was on the phone with the doctor, and I know it sounds cliche, but it was disbelief because I was 26 years old. And it wasn't until he said the word oncologist that I started crying and I understood what he meant.
The doctor did the exam and he said, And I said, what is that about? And then he told me that I had a nodule on the prostate.
I hung up the phone and I cried. And I knew I had to call my mom because she was waiting for the answer. So I called my best friend instead so I can get it all out because my husband was in the academy and I couldn't call him.
I didn't hear the word cancer right away. I heard the word tumor, which was, it hit me hard, but probably not as hard as if I would have heard him say, oh, you have cancer.
After all the surgery and everything kind of calmed down, then it set in mainly fear, kind of loss of control.
I remember coming home from the doctor's appointment the day they told me that I was faced with 1 to 3 years of survival. And I'd ordered a new pair of boots for work online. Saved a couple bucks. And I remember telling my wife, I said, go ahead and ship them back.
There have been a number of studies addressing the association between firefighting and cancer. Unfortunately, those studies had mixed results. Some showed there was an association and some did not. Because of those discrepancies, a number of organizations, such as the IAFF, the IAFC, the National League of Cities, came to NIOSH and said, we need additional data, we need additional scientific information about the association between firefighting and cancer, and would you undertake such a study?
I believe cancer isn't a big issue and hasn't been made to be a big issue in the firehouses because it seems like everybody has cancer. And they didn't really focus on firefighters. They're not realizing that when you go to the hospital, you're just another patient. You're not a firefighter to them. So they don't really keep track of, oh, wow, there's a lot of firefighters in here with cancer. They're not tracking that, where that's what we're doing. We're tracking firefighters and realizing how high it is.
One of the best studies that have been done looking at what type of cancers are increased among firefighters was a review or a meta-analysis done by Grace LeMasters at University of Cincinnati. And her study found that there were 3 cancers that were particularly high rates of death due to the general population. Those 3 cancers were prostate, multiple myeloma, and non-Hodgkin's lymphoma.
It really shook me being diagnosed with cancer.
And these things go through your mind at warp speed. The family, your marriage, the job, the financials.
I believe people are afraid of cancer. I think if they talk about it, then it's going to happen or it's real.
And I was pretty fortunate to have found a couple of firefighters within my own department that were cancer survivors that really understood what I was going through. And the thought came to mind that we in the fire service are a family all by itself, and we're kind of a unique creature. We
hear all the time that the brotherhood of fire departments and police and all that stuff, but we were babies in the academy, in the fire department, and it really did feel like a brotherhood. And it's not just what department you're in, it's the fire service in general. It's a brotherhood, it's a family, no matter what department you're in.
First thing I did was I came here to the firehouse and then told my crew. And that was the first time I had said it out loud, and it really hit me then.
And I found at my cancer hospital offered to go to their support groups for assistance in dealing with my diagnosis, and I didn't have a desire for that. However, I did find myself comfortable talking to other firefighters that were diagnosed with cancer or family members. And a small thought popped into my head. It's like, well, why don't we just kind of create a list of firefighters that are cancer survivors? And this is when I began to truly understand the magnitude of the problem we had with cancer in the fire service, and seeing how many survivors were out there, how many we had lost to cancer. And so this small little idea of putting a list of guys together and gals, firefighters that are survivors, to be available to talk to others that were newly diagnosed, and not have to go through being diagnosed with cancer and faced with phone calls of people offering support but no direction.
I was diagnosed with cancer. I really didn't have anybody to talk to. I felt isolated as far as the fire department job was concerned. I didn't want to talk to the fellow members, but I found out that talking to other firefighters, they've gone through the same thing that I have gone through, and they have a great insight to help me get past this difficult time in my life.
The advice I'd give to somebody who was recently diagnosed with cancer is you definitely want to get in touch with the Firefighter Cancer Support Network. Call the phone number on the website and get hooked up with a mentor that can talk to you about what their experience was.
I heard about the Firefighter Cancer Support Network through my husband. He was going through LA County Academy, and Mike and Soda Pop and everybody approached him and supported him, and that made its way through me. It wasn't just me they were supporting, they were also supporting him.
The Firefighter Cancer Support Network, once I called, gave me someone to speak with. They sent me a toolbox with a bunch of information on cancer and how to deal with it and where to turn. And there was someone there 24 hours a day that I could talk to, so you don't feel so alone. They're a firefighter also, so they know the specifics that you go through, not being able to work, and just that frustration of not being able to be physical.
Well, our goal, I think everyone's goal in this, in the outcome of what the NIOSH firefighter study would show, would be that we prevent future cases of cancer in firefighters. We may not be able to prevent all of them, but we certainly think we can reduce the number, and that would be the goal of ourselves, as I'm sure the goal of the Cancer Support Network as well.
Again, know about the different cancers that attack us because of what we do. Get your physicals. Wear your PPE correctly. Do all these things, so that you can have a long, fulfilling career.
My advice to anybody who's been diagnosed with cancer would be, don't be afraid to ask for help. The first thing you should do is actually tell people and reach out to the FCSN.
My advice to firefighters diagnosed with cancer now would be to be receptive to people wanting to help you. I know sometimes you just want to crawl into a corner and just deal with it on your own. And it's so much better when you have people that are there to help you and to support you, and just a shoulder to cry on. And you need that, and it's not a sign of weakness, though a lot of people believe it is.
I'm hoping that the FCSN not only reaches out there and is able to help those that are newly diagnosed, but we continue our march in our progression towards being proactive about cancer. Breaking down the walls, tearing down barriers about we're invincible. And we have an army of folks within the FCSN that go out there and promote this approach in educating firefighters. And the only way to continue to do that is by your generous support and your getting involved. We need you. We need to make a difference.
Hi, my name is Debbie Pike, and I'm a cancer survivor.
I'm Joe Nestor, and I'm a cancer survivor.
Hey, I'm Donna McDonald, and I'm a cancer survivor.
My name is Tony Cruz, and I am a cancer survivor.
My name's Mike DeBrun. and I'm a cancer survivor.